Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Eric Dinkins. Eric is an experienced physical therapist with a demonstrated history of working in leadership and managerial roles in the hospital and healthcare industry. He's skilled in spine, vestibular rehabilitation, manual therapy, healthcare management, and healthcare itself. Board certified, he is a board certified specialist in orthopedics and with an emphasis on eclectic patient-centered approach to physical therapy, utilizing mobilization with movement, manipulation, strength and conditioning, and strong healthcare services professional being there as well. He has helped to develop and bring to market 2 health education companies focused on both live and virtual learning with options of outside professionals to highlight and monetize their own course content via any platforms with him. And today we're going to talk about one of those platforms that you kind of brought to life as well. So thanks so much for being here today with me, Eric.
Yeah, thank you very much. Good to be here, Mandy.
So we got connected through one of my previous guests who I work with quite a bit, Dr. Brandon Allen, a neurological chiropractor. So he utilizes your services a lot. But before we kind of get into what exactly you do, I want to find out how you got here. So my first question is always, what led you to what you do today?
Yeah, wonderful. A good place to start. Especially for listeners trying to get an idea of background and specialties. So regarding motion guidance and the development of that technology and bringing that to market and giving offerings to various clinicians as well as individuals both in the United States as well as throughout the world. The genesis there was back in 2014, so it's been a little bit over a decade. I was working with another physical therapist named Tal Blair, working with him to do a residency to finish off his education. And while we were doing demonstration on knee body mechanics during various exercise implementation, he had the idea that it would be cool to put a visual feedback laser on the leg to help not only the clinician see, but the patient see in real time how their leg was moving through like a squat and a single leg squat and a step up and, RDL and that whole thing. And really to that point, most of the profession, I think, was using, cat lasers, and you'd tape them on a leg or, put them on some sort of headband and fasten that somehow. I think a lot of people are actually still doing that. That was our only option. So Tal had the idea of creating a ball and socket joint that you could mount the laser to, and therefore you could kind of swivel it around and kind of get the angles that you wanted to. And then you'd see a good representation of how people were moving or not moving while they were doing functional related activities. And so that's how motion guidance kind of got its start. And now we have developed onto reactive pod systems and cross-haired lasers and expanded the kits to different patterns that people can put in their clinic and put them on the wall and move them around. And so, yeah, that's the last 2 or 3 years has really ramped up from that technology side for us.
Yeah. Watching the technology kind of pop up for all sorts of different treatments for TBI and other neurological illnesses has been really fun the last couple of years because there's been a lot just kind of popping up all over the place. I used something like that laser with a physical therapist early on after my own brain injury a couple of years ago. So I would tape a maze up on the wall and then put the laser on my forehead and have me follow it. And my vestibular system was not working quite as well, but wasn't really scoring it either. So I wasn't timed. Right. I wasn't doing other multitask things. And when I started working with Brandon, I got to utilize your tools a little bit more. And we did the laser system watching it, and he had a TENS unit on the back of my neck. So we had the double stimulation going on there. Can you tell the listeners a little bit more about how that's kind of effective too?
Yeah, I think, again, the big breakthrough there is that clinicians are trying to get patients to understand what they're actually doing in space. And so there's a variety of ways that you can do that. Most people don't have the sensory perception after injury or just with chronic issues to be able to understand how they're moving. So with the head laser in that case that you were using it for, and being able to trace through a maze pattern where that's pretty highly cerebellar orientation and getting into the neck and the coordination of musculature to do that's not something we would normally do on a daily basis in the sense of get the visual feedback to do it, but we're actually doing it all the time just from, glancing and looking over our shoulder and understanding we want to be exactly where we think we are. And like you discovered, oftentimes we aren't doing the things that we think we're doing, and that can lead to overcompensations or undercompensations, that can lead to weaknesses, that can lead to changes between the integration between the neck and the head and the eyes, which is essentially telling us where we are in space, most of the day.
Hmm.
And those sorts of tracing patterns can be utilized, using targets to be able to turn and come back to where we think we are in space with the eyes closed can be able to utilize that. And then having some sort of, TENS essentially ends up being more of a tactile type of stimulus, just to tell us, where our neck is and what the muscles are doing when they contract and relax to coordinate movement. And those can all be utilized together. So you can do various forms of tapping. You could do um, just different tactile or haptic type of stimulations to coordinate those things, and those can be very effective if they're utilized appropriately based on the exam and the deficits and the decompensations that a person's feeling.
Yeah, yeah. It was really cool being able to kind of go through the maze with the stimulation on my neck, and realize how much more difficult it was once there was something else kind of distracting me, which made
Right.
sense for after a brain injury, how you can go out and you're overstimulated in the world. And then you find out that your balance is off when you're in a crowd because there's too much going on. So it's a really cool, different way to kind of work those areas of your brain.
Yeah, I think one thing that most people don't understand, maybe even a lot of clinicians, is essentially our body's constantly compensating for different inputs, whether that's coming in from the earth, from the feet up, whether that's coming in from different interactions of light or sound or, things moving around us in space. And if we can't constantly be compensating for those things, then essentially our bucket will be overflowed, and everything that's overflowing is just constant overstimulation. Your body doesn't know exactly what to do with that. And so in a metaphorical sense, many of our treatments need to be designed to drain the bucket, to create more normalization, allow for more compensations to happen. And that leads to other things that we can't really track. Neurotransmitter changes, hormone changes, things like that can lead to better sleep, better functioning, better maintenance of things like cortisol and those sorts of things that we can't necessarily take a pill for, and essentially get a giant reset. And sometimes we can reset permanently, and a lot of times we have to do the hopscotch approach, and we do 2 steps forward and 1 step, or 2 steps back, or 3 steps back, depending on what you did over the weekend maybe. And we design those programs hopefully on an individual basis to get people their maximum benefit from the treatments.
Yeah, yeah. So you started it with orthopedic purposes. I've used it and seen it used with TBI. What other kind of patient populations could you see this being used with?
Definitely sports and performance is a big one, just because people like the ability to have reaction and see what they're doing in space and link that directly into something that's competitive for them. People have competitive natures a lot. And we're starting to see it used more and more in the neurodiverse population with things like autism. Obviously, autism is a huge umbrella. There's a lot of things happening underneath that term. So I don't want to be too specific on, hey, we use it for autism, but for certain kids with their neurodiversity, they like having the ability to learn while they're interacting and something to keep their attention. And if they fall into that category, then we're starting to see some improvements with motion guidance for that. Posture and balance is a big one. Being able to, again, understand where you are in space and being able to do multiple things with your head and neck and with your trunk and with your arms. And so many times in clinic, we are just layering motion guidance feedback with other forms of traditional treatment just to enhance the effect and give people a better understanding of what's happening with their
Mhm.
bodies.
And what kind of practitioners are using your technologies?
Yeah, everything inside those realms, I think probably the biggest population is still the vestibular, functional neurology type of approach to therapy, or as complements to treatment. So if you feel like your layering for what you like to treat is very orthopedic based, and let's say someone comes in with chronic neck pain. Well, you could do my bias, which would be to do a mobilization with movement and try to change that input and see if you can increase their motion without creating any symptoms. You could manipulate them, you could needle them. But if you make an improvement, you're going to have an increase in kind of new body awareness and proprioceptive joint position sense things going on. So if I could only turn 30 degrees to the right without significant pain, and now I can turn 60, well, there's going to be a gap there. And you're either going to have to fill that gap through repetitive movement and body awareness. You're going to have to fill that gap with maybe strength and conditioning exercises, or you're going to fill that gap with doing something like you were doing, where I can turn into that new motion and then start tracing with the laser or interacting with the pods to create a remapping effect of what's kind of going on and how to coordinate that movement, regardless of how you choose to do those things from the initial treatment. Maintenance of that and making sure we're constantly pushing the treatment forward instead of just doing the same thing every visit is what's going to likely create the biggest benefit for the patient.
Very cool. Very cool. So, like I said, the first laser did was with a physical therapist. So, what sets the motion guidance laser system apart from the laser system that I probably use with the physical therapist, which is just the
Yeah, so
laser
the
stuck in my forehead?
motion guidance system has several different benefits. I mentioned one before. We have a ball and socket patent design that we utilize. So as we put this on any body part, I have one of our lasers here, but we have this cup underneath, and there's a ball that fits onto that, and then that slides onto our housing that you can attach to any body part. And what that allows us to do essentially is just put the laser where we want it, and then we can adjust the laser to fit the angle or the feedback that we want with patients. And so in the general sense of what we've always had way back in 2014 was that ability for people to more easily adjust what they want to get out of the system. With the reactive pod systems, the big thing that stands out for our system compared to other systems is the ability to have that laser interact with the pods. So if we, like, this is one of our pod systems that I also have here. So traditionally, most pod systems, in fact, everyone that's available, has a touch capability that's really more haptic. It creates off of a vibration versus just the physical touch. But if you tap these, and everybody's seen these types of systems out there, you'll react with the color that pops up with these. Well, our system with this silver field on the inside has an aperture where the laser can actually glance over that and it'll interact with the pod. And if the pod is on, it'll turn it off. It'll capture that data. So what that allows me to do is I could put this on the wall behind me, on any Velcro magnetized, or they come with their own mounting systems with our devices. And I could have the pod back there and have the laser on, and I can interact on that wall back there. That would allow me to do fine motor manipulation or juggle or bounce a ball or being in a very sports related position or a very posture related position, which is definitely going to be enhancing any sort of vestibular rehabilitation like you had to go through. And that'll interact all the way up to 80 feet. And so you don't have to be right by the pods. And that makes a huge difference because you'll see these on social media postings. People have multiple pods up on the wall and they're so close. So they're kind of like extending their back and they're having to, move away and then come in close. And we don't run into that problem with our system. And so we're really proud of that development and
Mhm.
that application. And the clinicians that understand how to use our system are just coming up with new phenomenal treatments that we hadn't even considered before. And so those are probably the two biggest things that set us apart from any other system that's out there.
Yeah. So when we connected before we came on for the podcast, you were talking about gamifying it. Does it keep a score when you do the laser with the pods?
Yeah, it sure does. So the pods interact with an app that we created also that you can put on your device, and so that's where you can actually create your own protocols too. So if you're gamifying your treatment by interacting with touch or laser, or we even have one of our apps that allows you to do both at the same time, just by designating different colors. That's a touch or aim function. It's pretty cool. It'll keep score. So if I just standardize that treatment for, let's say, for you. So if I put the laser on your head and I standardize where I put the targets on one of our mobile wall units, I can say we're going to go for 2 minutes. It's going to be at this refresh rate and it's going to be interacting with these different colors on the pods. And let's say you go through that, much like you went through the maze, but this would be much more of an interactive variability with the laser on your head or your arm or anywhere. And we can say, hey, you got 17 correct over 2 minutes and you got 3 incorrect, based on how we set up the game. If you come back the next week and you get 24 correct and 1 incorrect, we're obviously showing a percentage improvement there over that time. And we're more worried about obviously the carryover of, well, how do you feel in society and doing the things you want to
Mhm.
do with ADL and with, interacting at home and things like that, functional scores, more interested in that. But if both scores are going up proportionally, then we'd like to think that those things are linked together and the treatments that we're applying both to perform the game as well as the other things we're doing in clinic are leading us the right direction.
Yeah, yeah. I love the game idea because people are very competitive and they like to see those numbers. And there were several apps that my therapist had me use along the way for visual scoring and everything that I loved watching those scores improve. So if you can watch
Yep.
another score improve, it just gives you more data that, yeah, you're getting better.
Correct.
Is there any information on like how frequently people should be using the tools?
So there is data out there for other gamification systems that have been done over time in the literature, but we really don't like to promote some sort of standard or protocol yet because, especially with vestibular rehab and traumatic brain injury and concussion, it's all about that bucket level. If you're trying to implement a protocol and on a certain day, Mandy comes in and she's just over her limit, you're going to see her performance really start to drop. And so we have protocols that are preset on our app that people can go, hey, we want to do this game and we want to do level 1 or level 2 or level 3. And that way you kind of get a preset so you don't have to fiddle too much and everybody's busy in clinic. But if you're type A, you can also kind of put in your own specific parameters of what you want as a clinician. But it's really the system is designed to have data collected, have people gamify, have people stay engaged, and I think that's why we're seeing some good implementation on the autism realm of just something that actually keeps your attention for a standard amount of time. But then also we've noticed, at least personally in clinic and from our stories on Instagram and things, people are noticing, hey, people want to come back in. They go, well, I want to do that again. That thing we did last time. I've never seen that before, and that's kind of cool. And then you can say, hey, it's always fun when Mandy comes in for her second visit. She goes, so I got 17 last time. I think I can beat it, and you're like, well, did you get 17? And they remember, and they kind of use that as their own motivation tool.
Very cool. Very cool. When you're doing all this, are you guys keeping track of all that data so that you have research to put out there?
We do have it tracked on individual devices. We don't have a clouded model yet where we can kind of pull. We're working with a couple different groups, 2 different groups right now that have resources in research that we are hoping to start gathering that. There seems to be a very large push internationally, some people with our device, some with others, of creating almost like a gym model, but very specific to certain conditions where people can come in and say, we've researched these 5 things that you do for an hour. And these are the averages that we see over time if you just implement these things. It doesn't even have to be very specific. You're just doing these different things. You're doing some weight training. You're doing some balance therapy. You're doing some vestibular rehabilitation. You're doing some range of motion activities. You're working on functional skills. And if you just do those things 3 times a week, then these are the outcomes that we're seeing. And we don't have great publications on that yet, but the data is starting. The groups are starting. And so we're really interested over the next, even just 6 months. I think we're going to have some of that data. Some of it's coming out of Florida right now, that a group that we're involved with, 2 groups actually there. And then we have some other interests internationally. In the UK, we're working with a hospital group that's working with dystonia at the neck, utilizing our system to work with that. So we're really encouraged over the next couple of years. We're going to have a lot of that type of research publication and data to really kind of hone and advance and just see what the outcomes look like.
Yeah, yeah. I love the anecdotal stuff because I can always tell people my experience, and I've done all of these different things, and I've been very blessed to be able to try out all of the different programs that I've had on the show and say, yes, this helped me, or no, it didn't help me. And I like kind of vetting things out before I have my patients go through them. And I
Mm-hmm.
know that a lot of my peers, a lot of my colleagues love the data. So if you have something to show that what you do works, not just the stories because they're great, but it doesn't fill that data bucket that they need.
Yeah, you're definitely right. And if we can get those from multi-center trials and 2 or 3 different groups kind of finding the same thing, then it really has a lot of value. I think that we can all appreciate that, that you can slide data points around, you can, utilize or get rid of certain things that you do or don't want. Hopefully nothing nefarious is happening with those types of things. But if you can start showing that, across populations, in different studies are doing the same thing, then that gets really, really encouraging. And that's what we're hoping to do and hoping to find over the next 6 months to 2 years.
Yeah, yeah, because it's a cool system, and I really enjoyed working with it, and I'm glad that I've got patients like working with Dr. Brandon, so they've got that experience then too. Because they'll come back and they're like, "Hey, we got to do this," and I'm like, "Yeah, that was fun, wasn't it?"
It was fun.
It
Yeah.
makes that therapy fun. Like anything you can do to make the patients actually enjoy what they're doing. It's like with exercise. I used to be an exercise coach too. If you enjoy what you're doing, you'll keep doing it. If you don't, you won't keep doing it.
Right. Yeah. Especially if you sprinkle it too. I mean, doing the same thing over and over. And I was just talking about protocols, and that's kind of the design. I think that's just easier to research. But if you're saying, hey, you came in on Monday and you just did some reaction games, and then on Wednesday you did some memory games with the system, and then on Friday you did some dual tasking games with the system, like it kind of it creates a familiarity, but you're constantly doing something different. And so we have 15 app games that are designed to do that, where you can work on different aspects all by using the same system instead of just doing touch things on the ground. We're trying to implement based on the needs of what the clinician thinks that you need as a patient.
Now, is this something that would just be used in a clinic setting, or are there tools that patients can borrow or get themselves and work on them at home?
That's a great question. So our system we feel like is fairly cost efficient for what you get out of it. So just to get 5 of the pods, have a way to put them on walls or windows at home, get an interactive laser and be able to access, free app games. It's only going to cost that person $500, which I realize for a lot
Incredible.
of people that's going to be, a significant amount, but at the same time, that can just replace your home gym. That can replace, going out in the community to get other interactive treatment from other clinicians. And then we have models that are souped up where you have much more variability and flexibility options for utilizing those. And those get into the $1,000 to $1,500 range for clinicians, which still from a clinician standpoint, we don't think is a huge investment for what you get out of the functionality of it. There's definitely systems, just try to buy a treadmill, you're going to be over that. Buy a treatment table, you're going to be over that. Balance plates and kettlebells all run the number up too.
Yeah. Yeah, absolutely. Yeah, I asked just because when I was working initially working with that physical therapist, he had me get a laser and do some of the exercises at home. So
Mhm.
I went to my little Amazon shopping cart and bought myself a cheap little laser that it worked fine for the job, but sure wasn't interactive like the one you guys have. So,
Yeah, everybody's always looking for a way to minimize, and I think that's actually a really good thing. A lot of things that are promoted you can do on your own, or you can find your way around them. But I think that
yeah.
if I'm critical of my own profession, physical therapy, for my licensure, we typically try to overhack everything. Like, oh, we can just, we can use this, but just to do this, or we can do, I can draw those myself and put it up on the wall. I do think with social media, many of our patients in the community are much more savvy into understanding what's hacked and what's a professional system. We can utilize home programs in various different ways, but even a laminated card that has a standardized font with an X on it for people to look at, that looks better than, just a 3x5 card that you took a Sharpie and, are those going to do the same thing? Sure. Does it seem a little cheap and maybe cheapens your treatments? I think that's probably true also.
hmm hmm Yeah, quality is definitely there. So, and the more you can do with that tool rather than just having one single thing that you can do with it, I think is really helpful also. So, uh,
Yeah, I'm still a clinician, 4 days a week. I'm seeing patients, all day long, along with the things I do with motion guidance and then some other things. I'm biased, obviously. Everybody on this podcast listening to it would understand that. But,
yeah,
I'm using it for, 4 to 5 patients easily every single day. Is it going to be everything that I do? Definitely not. I see a pretty eclectic mix in the small town that I'm in, small, but it's 75,000 people
yeah,
in Castle Rock, Colorado. So, we're seeing a variety of different things. So I'll use it, more or less on a given day, or maybe just to enhance engagement. But I'm constantly using the system, over and over and the different apps that are applied. And we have those types of tutorials on YouTube and on our social media pages, on our own webpage, domain at motionguidance.com. So people can find resources pretty easily of how they want to utilize the system.
very cool, very cool. Do you have any upcoming events or projects or anything you'd like to share with our listeners?
We're constantly innovating. We just came out with our crosshair laser, which is out of the laser that's coming out. It creates a visual representation of a quadrant field for people to see exactly how they're moving or maintaining that. We have continuing education classes that we're launching in 2026. People can request those. We have 2 different offerings. We have one that's based around just the basics of motor learning and application of those types of principles, utilizing visual feedback and our system, as well as not using our system. It's all incorporated into the same weekend class. And then we're starting a new offering of head neck utilization with mobilization with movement, since I'm credentialed to teach that, combined with the motion guidance things for chronic neck pain, whiplash, concussion, brain injury, stroke rehab, like all those things that would just be essentially from here up, just combined in one class. So those are the new things that we're offering out in 2026. And so if anybody in this podcast is interested in hosting those types of classes or attending, they can go on the website and they can find that information.
Cool. I'm excited that you've got so much coming up for brain injury and whiplash. So that's all I see in clinic all day, every day.
Yeah, it's really an interesting field. I mean, there's so many things that kind of dovetail onto it too, from, barometric chambers to, needling to, the motion guidance things to hydrogen water to, I mean, just, everything's kind of being centered around. It's a hotbed right now. And that'll, just like everything else, I think it'll shake itself out and whittle itself down to, the primary needs. But it's kind of fun that everybody's taking a different vantage point on it, because we can, like you experienced, we can
Yeah.
maximize people's functionality by doing different things, red laser, red light therapy in different ways, things like nutrition.
Yeah.
Just can keep talking about different topics there and
Yeah.
just about what people can utilize. So it's really, really fun as a clinician, not just with what we're doing, but with what other people are doing.
Yeah, yeah, it's been, like I said, these last couple of years of learning since my own brain injury have been just phenomenal, because I knew the little bit that they taught us in school, which was just the tip of the iceberg in treating concussion and head injury. And I really didn't know anything deeper than that. I thought I was doing a great job, and I was with the information that I had. But
Right.
knowing now all of the things that can be useful, and I've tried all of those things that you mentioned. So I have personal experience with them now, so I can tell patients kind of what to expect, which is really cool, because not a lot of practitioners have that background and that knowledge. But just knowing that it's out there and that it works, it's nice to see all the things that we have now. I've had some patients come in at my office and they've had head injuries 8, 10 years ago, and there really wasn't anything to be done at that point. But we can try things now and they're still getting benefit because they've never tried it before. And,
Right.
neuroplasticity, it's a thing.
Yeah, well said. I think most clinicians, if you've been out in clinic for more than just even a handful of years, you've already stumbled upon some roadblocks that you've had. And then people kind of said, I felt better just by doing this. And you start looking into it and you're like, wow, that actually is viable, maybe not a cure,
Yeah.
but at least a facilitative treatment for that to try to drain that bucket. I can't tell you how many people over the years that have come in with chronic inflammatory conditions, and that can be from a rheumatoid like condition all the way down to like just a plantar fasciitis that just won't go away, or a frozen shoulder that just won't go away. And you start talking to them about hydration and nutrition and just say, you might want to take a 3-week sabbatical on some sugar and just try to push that out of your diet. Don't do anything different, but just try to really reduce that. And everybody feels better with that. I mean, they
Yeah.
typically sleep better, they breathe better, they, you know,
Think better, move better.
yes, all the things like, you got to give yourself a little bit of time for your body to adjust. It's not like you can do that on a fast
Yeah.
for, 12 to 36 hours or maybe even longer. And those can be very tough to do. And you should definitely always consult with a professional before you start something like that. But, those are maybe more toward the extreme cases, and sometimes just the simple things, getting out and going for walks outside can be super beneficial. Morning sunlight has been proven to be very beneficial. Other aspects like that, those are all free.
Mhm.
So that's nice. Just based on changes that you can make yourself. And
Right.
then, as I mentioned before, you layer those with other sorts of skilled therapy, like what we offer, or other forms of manual therapy or other forms of red light. And some people that have been stuck for years in the carousel can start showing some improvement with those
Yeah.
things. So,
Yeah. Yeah. It's
yeah.
really fun to be able to tell people that when they ask the question of how long is it gonna take to get better, and I said, "Well, the good and the bad is that there's really no endpoint in improving." Because if you haven't tried something, or if you haven't tried something in a different way, you can't say that you've done it all. And until you've truly done it all, you won't know. And sometimes repeating something that you've done before will still get your brain to do something different and to heal. So there's really
Yeah.
no endpoint.
Yeah. And speaking of that, I think everybody feels better. So I work at altitude. If I back up just a second, so I
Yeah.
live at 6,200 feet above sea level, and so I can't tell you again how many patients over the years have either gotten better or worse just by traveling to sea level. It's like, oh,
Yeah.
been feeling pretty good, and then I really struggled when I was in Miami or when I was in Mexico or something, and or I traveled to Europe, and you start to realize that maybe it was the altitude, maybe it was the oxygenation, maybe it was the food. Maybe it was the stress, like you actually got away from your stress bubble and you decompressed and you actually felt better for like 7 straight days. And then you came back, and we make a hypothesis of what that is. But if you can tie into the things that start making you feel better, that should mean that you can make a change. And if you can make a change, then it just turns into the game of how to sustain it. And if you
Yeah.
can, the more recognition we can get, the easier it is for people to at least have a little bit more control over their life. And I think that that's where, a lot of education recently has gotten away from pain as a designator of dysfunction and more into, well, it's the control that you have despite maybe your pain. and we
Yeah.
want to get rid of your pain, or we want to get rid of your dizziness, or we want to get rid of your tinnitus, whatever it is. But if we can find a management strategy to help drain that bucket, then people just start to feel more in control and feel
Mhm.
like they aren't as fearful for movement or lifestyle or whatever it is. So
Yeah.
it's all very encouraging, very exciting. I think that's why a lot
Yeah.
of healthcare professionals are still in it, right? It's like,
Yeah.
well, it's maybe we don't make the most as like a lawyer who gets to, sit in front of a computer, but we definitely feel like we make more of an impact on a daily basis for people that we interact with.
Right. Right. Where do you see the future of vestibular rehab based on your experience and what you've seen?
Yeah, it definitely seems to be a trend of less cookie cutter. There's things that we know that work and that do for like unilateral vestibular hypofunction and various types of dizziness. There's vertigo. There's things we go, this is what you should do. But we also start peeling back layers of people have either multiple things going on, or um, they have underlying conditions that are making their current symptoms even worse. I really think that AI in the next couple of years is going to dominate that space for helping us make good clinical decisions. I think we'll be able to say, well, the patient is reporting this, and then my tests are showing this. What's the most viable treatment and place to start? And I think it's going to come up with continued answers of at least a place to start. Because vestibular rehab is daunting, I think, when people try to get into it. We just launched a recent online class called Vestibular Basics, just giving you an understanding of, if it's this, you're probably going to go this way. If it's presenting like this, you're probably going to go this way. And then just keep an open mind, but utilizing with caution right now a large language model to kind of differentiate where you probably want to start based on what you're seeing. I mean, what the patient's reporting is, I think that's going to continue in just not just vestibular rehab, but in healthcare. It's going to be like, well, have you considered this? There is publications that suggest that, oxygen therapies could be very beneficial for this person with POTS or something like
Mhm.
that. And we're just going to have to start getting out of our space and probably cross referring also, where, hey, if I feel like they might benefit from that, I should refer to a place that has that. And then hopefully that person would share back with me, right? So we're
Yeah.
not just trying to say, this is the person I'm only treating with. It's probably going to be more team oriented toward the future as well.
Yeah. Yeah. I can see that too. I think we're all gonna have to be able to open up our minds a little bit and see what else is out there because as AI starts to give recommendations, it's gonna give recommendations of things that we're not familiar with. It's gonna bring up these 10 new technologies that people maybe
Yep.
haven't seen before.
And like I said, we're going to have to be cautious. I can't tell you how many times I've been on a large language model across various platforms, and you ask them once, and then you ask them again, and it's two different questions or
Yeah.
answers for the same question.
Yeah.
Or, oh, I'm sorry, I'm not doing that right. Maybe you need to give me more information. Be like, well, you sounded pretty definitive the first time. So what changed? So we want to be cautious in that approach, but I do think it's going to enhance. I do think it's going to get better. I keep seeing things where, this is meant to be in a very good way as far as feedback. People are they're in a healthcare crisis,
Mhm.
and the doctor's saying, no, I just think it's this. And they start putting in their symptoms into a Grok or a Chat GPT, and it says, well, you should consider these things also. And all of a sudden they have that thing that was
Yeah.
over, kind of brushed over from an ER physician or, anybody like that, or a PT, a chiro. And so, I think there's a lot of space for that to grow as long as we're doing it with caution, which means we should also be doing it with training and advancement and education. Like, hey, we should start having classes toward that realm of how to utilize that and how to do keyword searches and create the answer that we're actually looking for instead of something else.
Yeah. Yeah. I think that could be a whole nother conversation right there. But yeah, it's AI is the thing. I've got a colleague here in the Twin Cities who is trying to do a lot more with the healthcare AI and trying to build something that his practice can use that will be a little bit smarter than some of the other ones that he's seen. And I'm not that kind of smart person. I don't try to build any of that. I'm just trying to figure out how to utilize it to help me in my day to day. That's not going to make me feel uncomfortable.
Yeah. Yeah, and then still have an open mind
Yeah.
to, things like that. That's where we're going. That we just discussed today on vestibular rehab. Like, a lot of people are implementing treatments. Like, well, as long as you're seeing some benefit, I think there's value there. But not to do something 6 to 10 times just to take a random number and just,
Yeah.
well, it's not really improving, but I like it for 3 days. Be like, well, that's not really helping. Then
Yeah.
it's just showing us this. We're probably missing something a little bit. But yeah, I mean, there's innovators out there that I've spoken to, and ones that I haven't, and it's pretty exciting.
So see, even more reason for you guys to start gathering that data and put numbers out for your own treatments. So
Right. If anybody
Yeah.
out there wants to collaborate and find some, symbiotic natures with our tech, we're totally open. Contact us.
Sweet. Sweet. All right. To be respectful of your time here today, Eric, too, any last words that you'd like to share with our listeners before we wrap?
I just really appreciate the opportunity and the platform to be able to talk about some of these things and engage some interest out there. Not trying to, push a product. We're a physio-owned company. We're not a large fund, based organization, but we try to keep it as science-based as possible and need-based as possible for our users out there. And so we're constantly being contacted by people who are just looking for answers across the world. And so if anybody hears this and they have questions about their condition or other conditions, feel free to reach out, and we respond as professionals in giving guidance and answers. And if we don't know, we don't know. And so that's kind of another unique aspect of what we do here. So we just really appreciate the platform, Mandy.
Mhm.
So thank you.
Yeah, of course. Thank you so much for being here today. I always love giving people the opportunity to kind of to brag a little bit about what you do, but I think you do more than just the tools with all the education and everything that you're offering. It's much more robust than just bragging on the tools. So thank you so much for being here and sharing your knowledge with our listeners today too.
Oh, you're welcome. Thank you very much.
Yeah, thanks. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.